المشاهدين، أهلا بكم معنا في هذه الحلقة الجديدة من Scientific Meeting. نحاول دائما في كل حلقة أن نقدم لكم موضوعات في مختلف التخصصات الطبية. أعزائي المشاهدين، ويسعدنا أن يكون معنا ضيوف في هذه الحلقة أستاذ دكتور أحمد عبد اللطيف، أستاذ أمراض القلب كلية طب بنين الأزهر. أهلا بك دكتور أحمد. كما يسعدنا أيضا أن يكون معنا أستاذ دكتور منير ويليام، استشاري جراحة التجميل. أهلا بك دكتور منير. الحقيقة يمكن زي ما قلنا في البداية أن موضوع حلقتنا النهاردة عن السمنة وأمراض القلب. Let's talk first about obesity and how can we diagnose a patient of obesity?
Yes, obesity is one of the most important diseases in this century. Obesity is just increase in body weight in relation to sex, height, and of course there is multiple tables, something related to males and the others related to females, which say what about weight and what about height. Here I have to say that this increase in weight, there are two ways to increase weight. Either there is increased weight in order or according to increased number of fat cells, and that is what is known as obesity, our subject today. And there is also increased weight due to increased water retention and fluid retention. And this is another subject, which is edema. And today we are speaking about increased weight, which is obesity, according to increased fat cells.
Are there definite causes which cause this increase in the number of fat cells?
Of course, there are many, many causes. To start with, there is genetic cause. There, later, we can say that obesity has a genetic chromosome, which is related to chromosome number 17. Also, obesity, these 2 days, we find that obesity, there is increase in weight according to what is present here in this century. There is no movement, no walking, there is increased appetite, there is a remote control for everything. This light movement led to increased body weight. This is another cause. There is a third cause, which is endocrinal disturbances. There are some syndromes, those who are relating to pituitary gland, those syndromes related to thyroid gland in the neck, those syndromes related to suprarenal glands, and all these syndromes together or each one separate can cause increased body weight.
Is that mean that obesity can cause a systemic disease, or a systemic disease, or may a systemic disease cause obesity?
No. In the last century, you can say that there is systemic disease, and accordingly, obesity is subtype for this, or it is a symptom for this disease. But now, obesity is a disease. Obesity as a disease which may be accompanied by many other diseases, those related to the heart, those related to the endocrine disturbances, those related to any other causes, and so on.
The effect of obesity on the different systems of the body.
Oh, many, many effects and complications. Every part in the body can suffer from obesity. If you are going to the eye, you'll find suffering from obesity and hypertension and glaucoma and so on. If you are going to the body systems, to the heart, Professor Ahmed Bek can say what is about the effects of the heart and so on.
Obesity may be important predisposing factor for heart disease. But here I like to discuss something in particular in relation to obesity. A high percentage of obese population have got actually insulin resistance. And this insulin resistance is not a matter that is related to carbohydrate metabolism, but it is related to many complications, some important complications. Those people with obesity and insulin resistance will develop later on diabetes and will develop later on hypertension. And if you come across a patient who is obese and he has got hypertension, there is a high possibility, not less than 50%, that later on he will develop diabetes. And if you come across an obese patient with diabetes, there is a very high possibility that later on he will develop diabetes. And this complex of symptoms has got a clinical name, that's syndrome X. In medicine, when we refer to something as X, this means that it's something that is not clear, something that is rather obscure. There is a wrong impression among the population of our doctors that syndrome X is something rather rare. This is not true, especially here in Egypt. Here, a high percentage of people who are above normal weight, they are obese, and if you are going to investigate them, you will find that they have got insulin resistance, and at a later stage, they get diabetes, at a later stage, they get hypertension, and this is what we know as syndrome X. Syndrome X here in Egypt is very common. You, as a doctor, come across syndrome X every day, but sometimes you consider the patient as hypertensive, sometimes you consider him as diabetes, sometimes you consider him as only obese patient, but if you examine this patient and investigate him in a proper way, you will find that this patient is actually a syndrome X.
I think this is because it's like a vicious circle. Diabetes is, obesity can be considered as one of the causes of diabetes. Diabetes and obesity together can be considered as one of the risk factors of hypertension, etc.
Obesity is something which is apparent in front of us, but what is underlying the whole syndrome is the insulin resistance. And in a sense, it may play a role in the development of obesity by itself and plays a role in the development of hypertension. In some way, insulin resistance leads to hypertension, and also insulin resistance leads to diabetes, particularly type 2 diabetes, those obese diabetics. And so it is something, insulin resistance is something that rather collects the syndrome to one common pathway.
لو حبينا ان احنا نتكلم بالتفصيل عن السندروم ده، لو هو الدايابيتس together with obesity together with hypertension. الكرايتيريا بتاعت الهايبرتنشن in this syndrome is the same criteria of hypertension in general?
Actually, hypertension is of a special character in this syndrome, and it requires certain lines of drug therapy and certain lines of care in the patient. This is not an ordinary hypertension because it is associated with impaired endothelial function, and it is a sort of hypertension together with the insulin resistance and the diabetes that specially predisposes to ischemic heart disease. Those people with syndrome X are very liable to get ischemic heart disease, myocardial infarction, because the collection between the insulin resistance, hypertension, and diabetes together with obesity cause a special predisposition, more incidence of atherosclerosis, more diffuse lesion of atherosclerosis, more liability to thrombosis developing on top of atherosclerosis. This leads more commonly to occlusion of coronary vessels. We get angina pectoris, myocardial infarction, heart failure, sudden death, arrhythmias, and conduction disorders. And so this type of hypertension, in cases of syndrome X, also diabetes or even insulin resistance in syndrome X, these are cases that require special care, because here they are acting on the endothelial function, which plays a pivotal role in the development of atherosclerosis and its complications.
The discovery of these patients suffering from syndrome X, from which physician? The plastic surgeon when the patients came complaining of obesity, or at the cardiologist when the patients came complaining of angina or of hypertension or something like that?
I think it is a cooperation among all of us. When Dr. Munir comes across an obese patient, he likes to have a good figure. He wants to go to the seashore and be with a good looking. He will examine him. Surely he does not only care about his body weight. He will examine it. Once he suspects any of these complications, he will going to refer him to me. Also, when I get an obese patient and I want to manage this condition, it's a patient with syndrome X that has got hypertension and diabetes, and I want him to reduce his body weight, sure, I will consult Dr. Munir. And if this patient succeeds in reducing his body weight, I have seen thousands of cases that in these cases, hypertension gets improved and may completely disappear without drug therapy. Also, diabetes itself may disappear without any drug therapy, and will be this very happy termination for the whole condition.
Dr. Munir, what kind of investigations did you ask the patients when he came asking for the reduction of his weight?
Before any operation or before any treatment for obesity, we have to perform blood investigations, all blood investigations, full blood pressure, serum creatinine, hematocrit value, and bleed and coagulation time, and so on. Also, we must perform consultation from cardiologist for the patient if he is ready. If the patient is ready for operation, if there is no cardiac problem, no hypertensive problems, no diabetic problems, if there is any advice for performance of any operation, and so on. All these types of investigations must be ready before our eyes. Not every patient is ready for operation, and therefore no operation can be done before consultations from cardiologists, and this is very important.
So this patient has any problem concerning his heart or concerning
if there is any advice during
diabetes?
anesthesia, if there is any advice before treatment, if any drug must be taken for certain periods before operation and so on, this is very important before any operation.
Dr. Ahmed, if the patients came for a referral, as a referral to a cardiac clinic, when can you ask him to first reduce his weight? After that, you can look on his condition.
Reduction of body weight in these conditions is essential, and in every case I am going to ask the patient to reduce his body weight. And as I said before, reduction of body weight by itself can improve and manage hypertension, and also can improve and manage diabetes. But as we know, that reduction of body weight is something that will need time, and you cannot leave the patient with the risk of hypertension and diabetes together and with obesity until his body weight gets reduced. We have also to manage hypertension by this time, and we have also to manage diabetes. And it is a common experience to me that with drug management of these two diseases in an obese patient, when body weight gets reduced, I gradually reduce my anti-hypertensive therapy, I reduce my anti-diabetic therapy until it comes to a happy end someday that I may go without drug therapy and the patient is all right. I am caring so much about this triad of syndrome X because it leads to, as I said before, it leads to impairment of endothelial function, and this may lead to a particular case of cardiological disease that is known as cardiological syndrome X. X also means something that's strange or not obscure, not very clear. Why in this condition? Because in such cardiological syndrome X, you find the patient suffering from angina pectoris, chest pain occurring on exertion. When we do an angiography, coronary angiography by through catheterization, you may find that the coronary vessels are all right. No lesions are apparent.
Despite the symptoms or the typical symptoms of angina.
And also electrocardiographic manifestations. The electrocardiogram is showing ischemic manifestations. Coming to the catheter and angiography, you may find, sometimes you find lesions, but it comes strangely enough in some cases that you find no lesions in the coronary vessels. How can we explain that? The explanation for that is that when we do the angiography, we get the picture of the large and medium-sized coronary vessels, but the microcirculation does not appear in the angiogram. And in this condition, in cardiological syndrome X, the lesion is rather in the microvasculature, in the minute vessels. This is due to impairment of endothelial function, and they vasoconstrict, and also they fail to respond to vasodilator stimuli, and so the myocardium is ischemic in spite of the normal appearance of the large and medium-sized coronary vessels as appearing in the angiography.
Dr. Munir, the lines or the determination of the lines of management of an obese patient, how can we determine these lines?
This is an important question. For us, we have to do what is known as mass number. To divide obesity to 3 types, this depends on what is known as mass number. Mass number is a division of body weight in kilograms divided by square of length in meters. If this mass number is between 28 and 32, this means this is a mild obesity. And mild obesity has a line of treatment which differs from moderate obesity, in which the mass number is from 32 up to 38. The morbid obesity, in which we find the mass number is more than 38. And here, if we putting in mind how to treat obesity, in my own opinion, treatment of obesity depends on 3 lines. The first line of treatment is diet control. About many systems, systems such as regime and so on, we tell the patient what to eat and what not to eat, the amount, the calories, and there are many systems and many diet control systems. The second line of treatment is...
These different systems differs according to general condition of the
Of
patient?
course, of the general condition, about the body weight, about whether child, whether is adult, whether cardiac patient, or whether a diabetic patient, whether fasting patient or not fasting patient. There are many systems.
ده لان احنا بنجد ان ممكن كتير قوي من الناس بياخدوا اسلوب العلاج. يعني مثلا بيكون واحد من المرضى راح لدكتور ومثلا وصف له طريقه رجيم معينه، فبدون ما يرجع للطبيب بيتبع نفس طريقه الرجيم.
No, this is contraindicated, of course. The second line of treatment is treatment which depends on sports, on movements. Of course, sports are very important because sports, number one, uses fat as a source of energy. Number two, sports can use control by making energy from fat which is present in muscles, and so muscles becomes more strong. Also, number three, sports can lead to decreased precipitating of low density triglycerides on wall of capillaries and vessels, and therefore they decrease anginal symptoms and cardiac symptoms and so on.
Any type of sports or any exercises?
Of course, any patient needs a certain time, a specific type of sports according to his general condition. Cardiac patient is not such as adult patient, such as playing patient, and so on. Third line of treatment is, from my own opinion, is the plastic surgical rule of treatment. And this rule of treatment I'd like to explain. This depends on mass number, as I said. If the mass number is between 28 and 32, which is known as mild obesity, here liposuction is the main line of treatment. This liposuction depends on suction from fat which is present in specific areas such as buttocks, thighs, inner parts of thighs, outer parts of thighs, abdomen, and so on. If there is moderate obesity, we can find the line of treatment depends on dermolipectomy plus liposuction plus applications of muscles. If there is morbid obesity, line of treatment differs. This depends on what is known as gastric reduction in size and application of rings and so on.
But that means that the decision making of the use of surgical treatments came after applying different medical methods.
Of course, as I said, the first line of treatment is diet control. Second line of treatment is sport control. If these two lines fail, surgery comes next. But don't shift by surgery except in cases in which you find morbid obesity. But there are contraindications, many contraindications, such as cardiac patients, anginal patients, hypertensive patients, and so on.
Yes, here we can talk with Dr. Ahmed about cardiac patients or obese cardiac patients and the lines of treatment.
Always the obese cardiac patient has got a worse prognosis than the cardiac patient with normal body weight. Because you know, as it is clear, that obesity is a big burden for the heart. The heart will have support by circulation all this body weight. In addition to the increased incidence of hypertension in cases of obesity, increased incidence of diabetes in cases of hypertension, in cases of obesity, also the increased incidence of dyslipidemias in cases of obesity. And these three conditions, dyslipidemia, hypertension, and diabetes, are deleterious to the cardiac condition and more predisposing to atherosclerosis, more predisposing to atherosclerosis on top of atherosclerosis, thrombosis on top of atherosclerosis, and so obesity is not a favorable coincidence with cardiac disease. Always it is advisable to reduce body weight in cardiac patients. Also it is advisable to reduce body weight as a prophylaxis against coronary heart disease. Also the relation of obesity with syndrome X, and in syndrome X the incidence of ischemic heart disease is high, and these are conditions that are liable to many complications, much more than the normal person. Cardiac disease development in syndrome X is more violent than developing in a normal person who is not syndrome X. And so it is always important to manage obesity for prophylaxis and management of cardiac disease. There is only a very little explanation that in very old age groups, it has been found in some later study that those patients who are very underweight has got worse prognosis than the patients who are of normal or even overweight. And this in cardiac patients that are in very old age. This is strange enough, but it has got an explanation because in old age, a patient who is very underweight certainly has got some systemic other disease that is destroying his metabolism and interfering with his various body functions, and this is why it makes him of worse prognosis than those who are normal weight or slightly overweight. And so it's explained that this very old patient who is very underweight is the cachectic patient with other system disease, and that's why it makes the prognosis worse in these conditions.
The importance of follow-up and the observations in such patients, especially obese cardiac patients.
Well, any patient with diabetes, with hypertension, with cardiac disease, with diabetes, he should always keep his body weight under observation. And whenever he finds himself increasing in body weight, this should be a very warning, it will be a very alarming condition. He should be very alert of that, because adding a body weight is adding to more burden on the heart, more glucose intolerance, more carbohydrate intolerance, more liability to hypertension, more liability to heart failure. And in addition to this, sometimes the increase in body weight in a cardiac patient is not a process of adding body weight, of adding flesh. Sometimes it's a process of water retention. And cardiac patients are especially liable, and hypertensive patients are especially liable, and diabetics are especially liable to retain water in their body. And this is an alarming condition. The patient should always put an eye on that. Whenever he finds himself adding weight, he should consult his doctor. If he is adding more obesity, he should reduce his body weight, control his diet. If he is adding more water and salt and water in his body, this should be managed immediately because this is a serious complication.
And as you see, we have to differentiate here between just obesity, which is increasing the weight due to increased number of fat cells, and the increased number of fat cells, we can find that it differs before puberty than after puberty. Before puberty, we find fat cells increase in number. There is increased number of fat cells before puberty. But after puberty, most of fat cells, there is increase in size but not increase in number. Here we have to differentiate, as Prof. Ahmed said, between increased body weight according to obesity, which is a problem, maybe medical, maybe surgical, and there is or maybe there is combination, but increased body weight due to water retention and edema and so on, it's a medical problem only.
Dr. Munir, as you said before, that the different lines of management or treatment of a case of obese patient, whether it's medical form or during exercise or in the form of exercise or either surgical treatment, the rate of recurrence of obesity in these patients, what are the causes of this recurrence?
Obesity and the treatment of obesity is a manner of life behavior. If you see that there is a patient, there is still increased body weight, there is still increasing appetite, if there is still the behavior and the manner in his life is the same, of course, there is some problems will return again, and we will find fat cells will increase in number, and there is another increase in body weight. Once we operate, we have to say to the patient that there must be continuation of his reduction in his body weight. If there is any failure in his will to continue the reduction of body weight, there are many other problems. Yani suppose that you are operating on the abdomen, and then the patient is well and good in his abdominal anterior wall and so on, and this patient returns back and try to polyphagia and so on, you'll find there is increased body weight in another parts of the body, and here another problem is present, and the same complications to the heart, complications to the joint, and complications to the skin, complications to the eye and so on. No, there must be a behavior for his life. He must control his diet as a manner, as a will for his life. The mother in her house, she is responsible for her family. She is responsible for her children. She must control their diet. And this is a behavior, and this is a manner for life.
So it's not like every people think that treatment of obesity through surgical treatment, whether through liposuction or any other treatment, is the only line of management. But as you have said, that it's according to habits and following what the doctor said to them.
Surgery is not the end, no end. The manner and the behavior in his life for any patient is the end. And as you see, all these patients who are suffering from syndrome X, even after reduction in their body weight, they will come and continue their medical insurance with cardiologists and so on. And I think there are many cases to return back to surgery. What's your opinion, Prof. Ahmed?
Dr. Ahmed.
In conclusion, we hope for all our patients a reduction of obesity, regression of diabetes, regression of hypertension, very low incidence of cardiac disease, and a happy summer with good looking on the shore, on the seashore in this summer.
At the end of this episode, I'd like to thank you very much for your valuable information about our subject for today, obesity and cardiac disease. Thank you, Dr. Ahmed, and thank you, Dr. Munir. أعزائي المشاهدين، وفي ختام هذه الحلقة أود أن أشكر ضيوفنا الأعزاء أستاذ دكتور أحمد عبد اللطيف أستاذ أمراض القلب كلية طب بنين الأزهر، كما أشكر أيضا ضيفنا أستاذ دكتور منير ويليام استشاري جراحة التجميل. أعزائي المشاهدين، شكرا لحسن متابعتكم لنا وإلى اللقاء.